Good afternoon, Dr. Bregman. How are you?
Great, Linda. Good afternoon.
Well, I know you're a busy guy right now. A lot of therapy, a lot of therapy right now. A lot of people hurting, a lot of lonely people, a lot of mothers worried about their children. And that's why this next email is really poignant and so important, because there's a lot of mothers and fathers out there worried about their children, self-isolation. They're not playing in playgrounds right now. And so I think there has been a great amount of parents concerned about the mental health of their children. And this has to do this question of, when do you know it's time to look up a good therapist and get your son or daughter to have some professional help? And this person writes, I don't know, it's just signed Jonathan. I don't know where they come from in the country, but it doesn't matter, because this question could come from a lot of people. It says, "Dear Dr. Bregman, I really need your help. I'm worried about my son, who seems depressed these days. It's a scary time for all children, but my son is a sensitive little boy, and he just doesn't seem the same lately. He's not motivated, he sleeps a lot, and he's become very quiet. When do you know your child should get therapy?" Great question.
Well, yeah, that's a very good question, Linda. And this is the kind of thing I hear all the time. And first, it depends upon the age of the child. So younger children, latency kids, which are 8, maybe 12, then adolescents, and younger kids, before 6. Everybody, they're a little bit different. There's nuances to all of them, but there's some common themes. One of the most common themes I think a parent should look at, and we see in this case here, is some regression in the child's functioning. That is so important. In other words, change in sleep pattern, change in socialization, clinginess, so change in how the child really shows regression. And regression in terms of whatever the developmental age is of that child. A 0 to 6, all of a sudden, potty trained over, they don't know about potty trained anymore. What happened to that? Huge sign. So not sleeping, staying in mom's bed, that's the little kids. So we see regression there. Then the little older kids, some of the latency kids, 8 to 12. Well, these kids, similar. They start getting clingy, they don't get out with their friends, they don't eat, they could lose weight. So vegetative functions are affected, like sleep, eating, attention, can't go to school. The kids, even virtually, the kids regress tremendously. So we'll see that in the latency kids. Now, what do we see with adolescents? Well, unfortunately, we may see a lot of rebellion, a lot of real irritability, not
What
listening.
about drug abuse?
Oh, and then what about that? That's a real consequence with the teenagers. They start hanging around with the wrong kids, they don't listen, they're rebellious, they're not the same. So I hope this helped any parent, not just this parent, and take a look at how old the child is to stage their regression.
I think that's really good advice. But what do you think? Sooner rather than later to call a therapist?
Okay.
Yeah.
Now, great. Okay. Now what happens is, we don't want to think there's anything wrong with our kid. So
right. You justify all these things.
And denial. And most parents really, unfortunately, will wait too long because they don't want anything wrong with their kid. So if you see these things, treating things acutely is so much more efficient, and you get so much better results than if it's chronic. If your kid all of a sudden is a teenager and you think the kid's doing drugs, do something about it right away. If your little kid's not sleeping, not eating, well, what are we gonna do? Wait for the kid to be off the growth chart, weight chart? Get the kid to see a psychiatrist, psychologist, and get a good assessment.
How do you find a good therapist? What are your guidelines? What's your advice about that?
Well, there's a lot of ways to find a good therapist. Nowadays, believe it or not, it used to be that most people came from maybe their friends or from the pediatrician or a mental health person, a medical person. But nowadays, believe it or not, old Google and things like that are online. Like if you Google therapists, children, and then you'll see people in your area, read about them. I think the social media and people posting their experiences online is really helpful. I get so many patients from Google, and I think a lot of people shop that way, and it's really a very good way to find somebody who could read what other people are saying about the individual.
Right. Yeah. A lot of hurting kids out there. So let's get them help sooner than later.
Yeah, I hope a bunch of people take a look at this video and then they recognize in their kids and take some proactive approach.
Good advice as always, Dr. Bregman. Thank you, and I'll see you soon.
I'll see you soon. Bye-bye.
All right. Bye-bye.
Don't suffer alone. At BregmanMD, we can help with our years of online therapy experience. Just give us a call or contact us online.